I am Dr. Anna, and today I'm going to reveal the top 3 vitamins that every diabetic should take to reduce blood sugar. Did you know that there are nutrients that can act almost like extra support to help control your glucose? But beware, not all vitamins work the same way, nor are doses recommended without knowing exactly how. Stay with me, because by the end you will know exactly which ones they are, how to use them, and what to keep in mind so they actually work for you. We'll do this in 5 steps. First, I'll show you why vitamins can make a difference. Then I'll tell you what those 3 powerful allies are. Next, I'll explain how they work in your body. I'll give you the recommended doses and possible side effects. And finally, I'll tell you how to incorporate them into your daily routine to get the most benefit without risks. If you have diabetes and want to feel more energetic, better regulate your sugar and take care of your health without complications, then this video is for you. Stay until the end because I'll give you an extra tip that few people know, and that can boost your blood sugar control even faster. Let's get started. First, why talk about vitamins when you already have medication for diabetes? The truth is, medications are the foundation, but vitamins can help your body respond better, repair cellular damage, and even optimize how your body processes glucose. But be careful, it's not magic. It's science. And not all vitamins have the same impact or effect. Many think that just taking a supplement is enough, but the truth is different. The key is choosing the right ones, in the correct dose, and combining them with healthy habits. And this is where most fail and don't see results. Now, let's talk about the 3 essential vitamins for people with diabetes. Number 1, vitamin D. Did you know that over 70% of people with diabetes have vitamin D deficiency? This is no coincidence. Vitamin D not only helps strengthen bones, but it also plays a key role in insulin sensitivity. It's like it helps cells better listen to insulin's signal to absorb sugar from the blood. A striking fact, low vitamin D levels are related to greater diabetic complications, from kidney problems to blurry vision. That's why maintaining adequate levels is not just recommended, but essential. The recommended dose varies, but commonly it's suggested between 1,000 to 4,000 IU per day, depending on your current level and medical advice. It's very important not to exceed this because too much can cause hypercalcemia. That is, too much calcium in the blood, which can cause nausea, weakness, or even kidney problems. How to add vitamin D to your routine? The most natural way is moderate sun exposure, but I know that's not always possible. That's why foods like fatty fish, salmon, mackerel, eggs, and fortified dairy can help. There are also vitamin D supplements that regulate your levels even when diet isn't enough. Impressive, right? But there are still 2 more vitamins, and number 2 that I'm going to tell you about is even more powerful in its immediate effect. Let's continue. Number 2, vitamin B12. This vitamin is vital for the nervous system, but watch out, it can affect how your body processes glucose. People with diabetes are at higher risk of B12 deficiency, especially if they take medications like metformin, which can interfere with its absorption. Why is this important? B12 helps keep nerves healthy and can prevent diabetic neuropathy, that nerve damage that causes pain, tingling, or numbness in hands and feet. But also, prolonged deficiency has been seen to affect sugar metabolism. A daily intake of between 2.4 and 2.8 mcg is recommended. In cases of confirmed deficiency, injectable administration may be necessary to restore levels faster. Side effects are rare, but in some cases may include allergies or digestive discomfort. That's why you should always consult before starting supplements. Incorporating vitamin B12 into your diet is also simple. Red meats, fish, eggs, and dairy products are good sources. If you're vegan or vegetarian, it's harder to get enough B12 without supplements. This may sound technical, but here comes something few know. Properly supplementing with B12 can improve your daily energy and help your metabolism work much better. Something crucial if you're fighting high sugar. We're almost at vitamin number 3, which may be the most interesting because its effect goes straight to the root of the problem. Number 3, chromium. Chromium? Yes, a mineral vitamin that doesn't always get the credit it deserves. Chromium is a trace element that boosts insulin's action by improving glucose uptake by cells. It has been shown to help reduce insulin resistance, one of the main factors that makes controlling type 2 diabetes difficult. The most interesting thing is that taking chromium in the right doses can improve blood sugar control in weeks. It's not an immediate effect like insulin or medications, but it is noticeable and consistent. The recommended daily dose for adults is usually between 25 and 35 mcg, and some medical interventions use up to 200 mcg under supervision. Don't exceed this amount without indication, as too much can cause digestive problems or interfere with other minerals. How to add more chromium to your diet. Chromium-rich foods include whole grains, broccoli, grapes, and lean meat. There are also specific supplements that combine chromium with other vitamins to improve absorption. Now, if you're wondering, do these vitamins replace medication? The answer is no. They are a support, a complement. But if used correctly, you can improve your results, reduce complications, and feel better. Want to know how to integrate them safely? Here comes the practical part I promised. To incorporate these vitamins into your routine, first get blood tests to know if you have a deficiency. Don't take supplements on your own because excess can be as harmful as a lack. Always consult your doctor or nutritionist. Then, start with moderate doses and increase only if indicated. Combine supplementation with a balanced diet, moderate exercise, and constant medical monitoring. Also, take advantage of natural sources. Don't underestimate a good meal that includes fish, fresh vegetables, and eggs. Small changes can transform your blood sugar control. To help you understand better, imagine these vitamins are like adjustments to your body's engine. With the right fuel, it runs more efficiently. Now, do you want the extra tip I promised? Many people with diabetes don't know that pairing vitamin D with magnesium boosts its absorption and effectiveness. Magnesium also helps improve insulin resistance. Taking both together can be a more effective strategy to regulate blood sugar. So don't just think of vitamins separately, but as a team working together to change your metabolism. Before closing, I want you to remember something. Controlling sugar is not a matter of chance or just luck. It's knowledge, action, and consistency. These 3 vitamins are powerful tools. But real change comes when you take control of your health with informed decisions. I'll end with a strong message. Don't settle for high sugar levels just because that's your diabetes. There is a lot you can do today to improve. Incorporating these vitamins, talking with your healthcare professionals, can be the first step toward a future with fewer complications and more energy for you. If you liked this video, don't forget to like, subscribe, and activate the notification bell to get more valuable health tips. You can also leave your questions in the comments. I read them all and will gladly help you. Thank you for trusting me and joining me. Remember, diabetes can be managed better when you're well-informed. Now you have a clear roadmap to add vitamins that really make a difference. See you in the next video. Take good care of yourself.